Effective communication. The objectives for this review are the learners will be able to, number 1, list effective communication tools. Number 2, describe how effective communication impacts healthcare. And number 3, summarize communication tools used at Von Voigtlander Women's Hospital. Ineffective communication is one of the top root causes of maternal and perinatal injuries and death. Michigan Medicine is a high reliability organization, meaning we drive a culture of safety and recognize that errors are usually caused by a system issue and not an individual one. High reliability means our goal is zero patient harm and high quality care. Effective communication is a culture of safety pillar. When we practice effective communication within the healthcare team, we will reduce length of stay, decrease nurse turnover, facilitate higher quality care and improved patient outcomes, provide a greater ability to meet patient and family needs, and improve patient and staff experiences and satisfaction. We have all experienced communication breakdowns at some point during our day-to-day life. Can you tell me some barriers to effective communication that you've experienced? The graph in the middle depicts barriers that we could encounter on a daily basis during our work. Often we have many distractions, shift changes, misinterpretation of communication that we receive, conventional thinking that we've always done it this way, inconsistent team membership. Think about those residents that rotate and change assignments monthly, or even more frequently sometimes. A hierarchy, lack of care coordination and follow-up, role clarity and responsibilities, ambiguous orders and direction, complacency, time, compassion fatigue, something that we've all experienced at some point and could be experiencing currently, conflict and defensiveness, and lateral violence. What does lateral violence mean to you? It's that disruptive behavior that occurs between members of the care team. What are some high reliability, effective communication tools that we could use? There's echo, readback, and feedback. The one that we're very familiar with, SBAR, situation, background, action, recommendation. There's advocacy and assertion. Or how about the 2-challenge rule? Assertively voicing your concerns twice to ensure that you're heard and that you're understood. The desk mnemonic: describe, express, suggest, and consensus. Or the one that we're all very familiar with, the CUST mnemonic: I am concerned, I am uncomfortable, this is a safety issue. There's also task assistance, or helping each other out. This rebalances workload and creates additional time for us to effectively communicate. And then lastly, professional and productive difficult conversations, taking those off stage and not having them in front of patients, their families, or other coworkers to try to find a resolution to any issues or concerns. At Von Voigtlander Women's Hospital, we utilize many tools to help us effectively communicate. Some of those include bedside shift report. And we would do that every patient, every time there is a handoff to a new nurse. It is a requirement also of Michigan Medicine that this occurs. We must document it in the patient flow sheet, which we can also access from our phones. it is directed that the oncoming nurse is the one that is required to do this documentation. However, the offgoing nurse may document it as well, per their choice. We also complete robust patient transfers. We text, call, and meet at the bedside to perform a safety check, not only for the patient and any drips that may be infusing, but also of the baby identification bands. We complete collaborative interdisciplinary huddles at specified times throughout the day, and those in turn create situational awareness on the unit. We continue to utilize SBAR. We also have teams that can facilitate escalation of concerns. Those include the early warning team, the chain of command, and our emergency teams. We also have the ability to send out birth center alerts. We practice closed loop communication. There's also an inpatient handoff tab in my chart that is utilized by the residents to document upcoming plans for care and also document what has already been done. We practice briefing and debriefing. We've currently added role shadowing into orientation curriculum, peer support, educational resources, team building activities, and utilize safety event reports to track and trend all safety events. And lastly, compliance reports used to report disruptive behavior and lateral violence. We do have support resources to help us with our communication. Unit leadership is available, as well as the chain of command, the Office of Counseling and Workplace Resilience, Compass Peer Support, which is made up of peers that work within the area that you work, and the Corporate Compliance Hotline. Remember, communication should be proactive, not reactive, and complete, clear, brief, and timely. How can you communicate more effectively? I encourage you to review and reflect on your communication and things that have happened in the past or that could come up in the future. How could you respond differently to assure you are heard? What is your communication goal? What part will you play in our high reliability organization?